This is Hello Healthy, a Dignity Health podcast.
We are honored to announce that Mercy recently received a Center of Excellence designation for minimally invasive gynecology surgery. Today, we're going to hear more about this designation and what it means with Dr. Justin Lee, a urogynecology and pelvic reconstructive surgery surgeon. So, Dr. Lee, to start off, tell us a bit about your specialty.
As a urogynecologist, I perform advanced pelvic organ prolapse surgery, including female urinary incontinence. The term urogynecology was back in 30 or 40 years ago in regard of gynecologists that specialize in very particular surgery for prolapse and urinary incontinence. And the urogynecology field has been recently granted the certification for what we call female pelvic medicines and reconstructive surgery.
Now, what is minimally invasive surgery when it comes to gynecology procedures?
Well, Caitlin, as you know, the advance in computer technology and laparoscopic instruments have allowed us to offer, minimal invasive approach with a small incisions, which is about 1 centimeter or 1/3 of an inch instead of traditional large abdominal incisions, to such broader range for patients in the field of gynecology surgery. It means small incisions, faster recovery times, reduced pain, and scarring. As of today, many of the procedures can be successfully done by minimal invasive approach in most of patients, and especially gynecology, including hysterectomy, which is removal of the uterus, oophorectomy, which is removal of the ovaries, myomectomy, the removal of the benign fibroid in the uterus, even ectopic pregnancy, and some treatment for endometriosis and pelvic pain. In particularly for urogynecology and pelvic reconstructive surgery, such as sacrocolpopexy. This is the term that I used to ask my son if he really wanted to join the spelling bee competition. And it is spelled out the term sacrocolpopexy. Which is a treatment for prolapse of the vagina and other prolapse of the conditions like cystocele, the bladder drop, or rectocele, where the protrusions of the rectum toward the vaginal opening. Some of the minimal invasive surgeries are also involved with gynecology, oncology, a treatment for gynecologic cancer to patients, and reproductive and gynecology. So that's what it means by minimally invasive surgery.
So let's talk about this Center of Excellence designation. Why is this important to your specialty?
Well, Caitlin, if you look at the concept for Center of Excellence, date back in the 1960. At the time, it generally described as a facility or a hospital or an organization which has value that is above the norm of the specialty of interest. Center of Excellence refer to a particular specialty that works incorporates the highest standard of practice into their entire scope of operations. Especially for the Center of Excellence in Gynecology is a commitment to provide the excellence in patients' experience, the outcome, and post-operative care, which is the care after surgery. In order to adhere to this commitment, Center of Excellence in Gynecology has to incorporate 3 major factors, as I listed here. One is surgeons of excellence are among the best in the specialty of their field. Center of Excellence teams also need to demonstrate the safety, the efficiency, and the best clinical practice. And third is Center of Excellence teams need to provide a protocol and pathway for certain procedure along with the standard of care and the quality of each patient from the point of care at the time when they present to the doctor office, to the procedure, the discharge from the hospital, and then post-operative visit and best outcome.
And so what does this designation mean for the greater Bakersfield community?
Good questions. Mercy recently received the Center of Excellence designations from SRC SRC actually stands for Surgical Review Corporations. It is an independent third-party assessment. What they do is they evaluate and review diligently to all the aspects of their requirements for such designations. This is very important, as you know, because it recognizes the achievement of the physicians, the nurses, and other members of the healthcare team, especially the administrations and director of operations and OR director and nursing director within the minimally invasive surgery who work together to maintain the highest standard of care, leading to better patients' outcome. Especially for the Bakersfield community, it means that now we actually have the Center of Excellence recognized nationally and internationally for its best care in minimally invasive surgery at Mercy Hospital in downtown.
Great. Dr. Lee, is there anything else you want to add to our conversation here?
Well, I think that, I'm very happy and very proud of this achievement along with other surgeons who, devoted their times and dedicate their time and their expertise and develop into this field of, especially develop into Center of Excellence for the community here at Bakersfield. And of course, I have to shout out the word to the CEO, the admin team who support us tremendously in the past years and bring us to the best that we can be.
Absolutely. Well, congratulations, and thank you so much for joining us today.
Well, thank you so much, Caitlin.
To learn more about urogynecology and pelvic reconstruction, head to dignityhealth.org/Bakersfield/women's-center. That's dignityhealth.org/Bakersfield/women's-center. Find more interesting and informative podcasts in our podcast library and be sure to share them with all your loved ones. This has been Hello Healthy, a Dignity Health podcast. I'm Caitlin White. Stay well.